We will align every payment, every incentive, every structure behind those outcomes. One way will be through the tariff, the way we pay for the vast majority of NHS services, especially in the future. The tariff should not be just about providing a particular treatment in a particular way. It should be how we deliver a particular outcome. That in itself will be a powerful driver of innovation within the National Health Service. I remember in the past when we were innovating in relation to stroke services, the tariff wasn't catching up because the tariff was structured around particular procedures measured in particular ways. We need to be focusing upon how we measure the outcomes and paying for outcomes, not paying for processes. Just last week I was at Bart's Cancer Centre and they're introducing CyberKnife, which is a new radiotherapy-based alternative to surgery and cancer treatment. But what they need is for the tariff to be there in order to enable that to happen. We've got to focus on the outcomes to enable that to happen. Otherwise, it will be a constraint on our ability to innovate, your ability to innovate across the service. So by paying for outcomes rather than particular processes, we can free commissioners to commission for outcomes. We can incentivise healthcare providers to innovate in order to deliver constantly improving quality of care and their own efficiency and value for money for how they deliver that care. The result will be money flowing towards the best and most innovative treatments, just like those that are being promoted here today at Expo. We are opening up the health service to any provider who can deliver NHS services at or exceeding stringent NHS quality standards and at NHS prices. As patients gain control over their own care, as they exercise more choice about what, where, when and by whom they are treated, healthcare providers will compete on the quality of care that they provide. Now, some people worry that providers will compete on price, but actually with fixed national and local tariffs, that simply isn't the case. At the point of referral or the point of patient choice, quality will be the only consideration because price for all providers will have been previously determined through the tariff processes. It will no longer be enough for a provider to presume that just being the closest hospital is good enough, not when patients can see quite clearly how well they're performing or not performing relative to others. It will no longer be enough for a provider to do things the way they've always been done, because others will be innovating and improving, and our transparency means that increasingly the public and other professionals will be able to see the quality of what is being done. And Bruce Keogh and his colleagues in cardiac surgery demonstrated how that process of clinical audit, leading to greater transparency, benchmarking against the best in the world, has been integral to the process of our cardiac surgeons delivering results that are literally amongst the best in the world. So this transparency and contestability between providers will drive up the quality of care, the outcomes of treatment and the experience of patients. Now, the role of government is not to enforce innovation. You can't mandate innovation. You can't publish the 2011 Innovation Act. It doesn't work like that. What we can do, however, and we are doing through the Health and Social Care Bill, is to create an environment that promotes it, which supports it, which enables the benefits of innovation to be spread more widely and more quickly. In the past, the NHS sometimes has been as successful as it has, notwithstanding the system rather than simply because of the way the system works. Modernising the NHS must change that. We must ensure that bureaucracy does not stifle innovation. We must replace top-down direction from Whitehall and from tiers of management to clinician-led, patient-focused innovation from the front line of the service. We're seeing that already. The commissioning consortia of general practice-led groups, working with clinical colleagues across primary, secondary and community care, working with local authorities so the public and democratic accountability is engaged, designing health services best to meet the needs of their local community. And I can already see when you start to bring clinicians from across the NHS to talk about how best to design new services for patients, institutional silos start to fall away. Conversation becomes one of how to best to design along the patient's pathway of care, linking up in a more integrated fashion. breaking down the walls that divide clinicians, we will start to really get into that seam of ideas and creativity based on improving outcomes for patients. Ideas that cannot come through a top-down bureaucratic system. Already there are 177 of the Pathfinder general practice-led commissioning consortia. That covers 35 million people right across England. They are leading the way to the new system, taking up the reins in their local area, representing and delivering for patients. And as well as doing that at the commissioning level, we will do the same with providers. At long last, after previous governments said they'd do it and didn't, we will now bring NHS trusts through to foundation trust status over the next 4 years. Free then to deliver for the benefit of patients responding to the commissioning of care by GP-led commissioning consortia. And as the money flows to follow the patient, the quality of clinical outcomes that a provider can offer will deliver the best success. That will always depend on them being ahead of the game. There are many people here from right across the private sector who know that process of competition doesn't fragment the care. It actually sometimes means the only way to do it best is to integrate care, to make it work together, to integrate along supply chains and value chains. And that is exactly what will happen in the NHS as well. It will be a means by which we drive improvement, not least by ensuring that people are clear that they need to work together in order to make that improvement happen. They cannot sit in their organisational silos and say, the patients will come to me. You have to be out there making sure you deliver the best care for patients. Now, beyond what I've described, there is another very important role for government. We must do everything we can to make sure that the United Kingdom continues to be one of the best, if not the best, place in the world to conduct cutting-edge clinical research. Just on Monday of this week, I announced that over 5 years from next April, we will be providing up to £775 million over 5 years through the National Institute for Health Research to promote translational research and development. It is a major increase in the resources dedicated to delivering from science and discovery to benefits for patients. Those funds will be available to any NHS university partnership through the call for proposals that we've now made, working in collaboration with industry and with the charities and the voluntary sector as well, very often being a central part of that. Those resources will drive innovation focused on some of our greatest health challenges, things such as dementia, cancer and heart disease. It is the second wave of this funding. It follows the first. We've already seen through the biomedical research centres and biomedical research units some of the benefits of that, things like stem cell technologies for treating age-related macular degeneration, a new blood test to diagnose Alzheimer's disease, or a new mechanism for measuring blood pressure that takes the blood pressure continuously much closer to the heart, which is very useful in diagnosing stroke, for example. And when you think of the measures that we have had to take across government to tackle the debt and the deficit, the fact that we are supporting not only the NHS, but science and research, and we are doing it now in ways that are increasing significantly our support for translational research to get the best treatments through the NHS for the benefit of patients, is, I think, an important signal that we as a government are truly putting our money, I have to say your money, where our mouth is.